As a responsible person with growing concerns for your privacy and personal liberty, you want to know where we're headed and what you can do about it. We ask the experts what you need to do to take prudent and responsible action to safeguard your family's wealth and well-being, and what basic first steps will help you to be aware and prepared. ReluctantPreppers.com.
Welcome back, Reluctant Preppers. Tonight we have an extremely special guest, an expert in the field of medicine, Dr. Paul Byrne MD. He is not only a neonatologist, he is the founder who started the field of neonatology. He also started the first Premie intensive care unit, and he invented the Premie blood pressure system. He is here today to talk with us as we focus on being aware and prepared of awareness of the untold side of organ donation on the topic of, does the government own your organs? Welcome to Reluctant Preppers, Dr. Byrne.
Donegan, thank you very much for inviting me to have this discussion with you.
Now, you are a pioneer in this field and have spent a good part of your career in trying to raise awareness of the untold story of organ donation. If you could give us just a quick understanding of your background and how you came to be so concerned about this topic.
Well, the first patient that I encountered with these questions was a patient by the name of Joseph in 1975. And Joseph was on a ventilator for several weeks, and a brainwave test was done, and it was interpreted as being consistent with cerebral death. And I saw death on his chart, and I saw Joseph, and it seemed like these things, that something was seriously wrong because Joseph was not dead.
And in layman's terms, cerebral death is what's commonly referred to as brain death, brain dead?
Well, yes, there's a lot of different terms that gets used, and there's a lot of different criteria that get used. None of them are for true death. They're all for designating some kind of condition that is not true death, but something so it becomes a signal to do something else, like cut out the organs or turn off the life support. It was suggested to stop treating Joseph, but I continued to treat him. And eventually he went home from the hospital. He went to school. He got good grades, ran track, played baseball. He's married, he has 3 children. But he was the patient that started my study of the subject of brain death. And brain death is fake death. It's not true death. It's just fake death. It's what they made up primarily to get organs, but it's also used to stop treatment. And what makes somebody dead is the action that's taken after their the declaration. Like if you turn off the ventilator or if you cut out the beating heart, then of course no one recovers after they've had their beating heart cut out. And so brain death is in some ways similar to life insurance. That is, people purchase life insurance, but it has nothing to do with life. It has to do with death. Well, brain death has nothing to do with death. It only has to do with life. People that are called brain dead are alive, and it's just made up to get organs. And every organ that's transplanted is a healthy organ, and it comes from a living person. There are essentially no organs that can be transplanted from a cadaver. A cadaver is a dead body, and everybody realizes that when death occurs, there's destruction, and of course there's destruction of the vital organs, and it occurs quickly when there is no oxygen supply to those organs. So organ transplantation involves getting somebody who is living and then coming to some conclusion so they can get organs. And when people go to the License Bureau and they're asked the question, do you wish to be an organ donor? Those who say yes are surmising that the organs will be taken after they're dead, when in fact there are no organs that are suitable for transplantation after true death. Now, I know that this might be difficult for people to hear because they might not have ever heard it before, and yet it's kind of things that if they just think about it, it would make sense to them, because most people can know the difference between life and death, and then the other thing that adds to the mix-up about the situation is the only thing you hear about is the recipient of the organs. And of course, we see someone who has received a heart or received a liver, and they're alive, and we're excited for them. But we also know there is no way that you can get a heart for transplantation unless it's a beating heart. There is no way that you can get a whole liver for transplantation unless it comes from a living person. And of course, after the whole liver is cut out, or after the heart is cut out, then the donor is dead. And so people concentrate on the recipients, and of course, we're happy when we see someone who continues to live after they've received a heart. But on the other hand, we know that the one that they took the heart out of was killed in the process.
That's something that you never get told. I am astonished at when I've been in, and most people will this will immediately be recognizable to them. You go to the Department of Motor Vehicles to get your license, and there are posters all over the walls about donate life, share life. My son saved 5 lives, and there's brochures on the counter. There's posters on the wall. There's a person ready and smiling and ready to have you say yes and put the check mark on your license. But only one side of the story is being told. That's what is true in so many other areas that we try to expose on our channel here. We try to talk about the untold story, and I was just shocked when I attended your live lecture, and you talked about that only from a living donor can viable organs be harvested. And you talked about that it's not until the organs are harvested that the donor actually dies. And in doing that, we aren't informed about that, but can you describe a little bit more about what has passed for the definition of death? You mentioned true death is no longer held up as the criteria. It couldn't be. So what is the definition of death, and has it been reliable and unchanging through the years, or what's the story of that?
Well, the first set of criteria that was published was called, first of all, it was called a definition of irreversible coma, and it was labeled as the Harvard criteria. That was in 1968. Between 1968 and 1978, there were 30 different sets of criteria that were published. Each one tended to become less strict than the previous ones, and there are many more since that time. They're all different, so a person could be declared dead by one, but not by the other. And in my own investigation, I looked at the Harvard criteria and asked, is it based on science? And the way progress is made in medicine is that new things are developed, and then they're tested on dogs or cats, rats, that kind of thing. Well, there were no animal studies in that article. And then the next thing that happens in medical science is that when something is new, they try it on a few patients before they try it on more. In the case of the Harvard criteria, they didn't do any studies on dogs or cats or rats. They didn't do any studies on human beings, on human persons. They just published this set of criteria. And the common denominator to all of the criteria is that the patient is unconscious. And of course, unconscious is a strong word, but what it means is that the patient cannot demonstrate that they are conscious. They cannot demonstrate that they can respond. So someone who's declared brain dead is unconscious, and then they talk about an absence of brainstem reflexes, but those are just reflexes that involve the lower centers of the brain, and they are not functions, but they're reflexes. And the difference is that when you go to the doctor and the doctor taps your knee and your knee jumps, that's a reflex. If you walk, that's a function of the leg. So they test only the reflexes, the brainstem reflexes, and then the only function of the brain that's tested is the function of taking in a breath. And they determine that the patient can't take in a breath by taking away their ventilator. These persons are on ventilators. The ventilator is a machine that we use to help people to breathe, but the only thing the machine does is pushes air in. It doesn't even make it come out, and it only works when the lungs are healthy and the heart is healthy and the heart is circulating and the liver's functioning and the kidneys are functioning, and that means it only works when somebody's alive. When they're a cadaver, the ventilator won't do a thing. And so the patient is unconscious and on a ventilator, and then to determine that they can't take a breath, they take the ventilator away. You and I and most people take a breath every 3 to 5 seconds, so 12 times a minute, 15 times a minute, 20 times a minute, we take a breath. Well, these patients that are on the ventilator, they take the ventilator away, and there's no breath, not just for 30 seconds or a minute or 2 minutes, but for 10 minutes. They suffocate the patient. They make the carbon dioxide go up, and when the carbon dioxide goes up, that makes the brain swell and makes them get worse. And that's known as the apnea test. And the apnea test, incidentally, is not a test for sleep apnea, but the apnea is a test where they take away the life-supporting ventilator for up to 10 minutes. And everybody who is listening to this program must learn a couple of things, and one of them is to learn that if their relative is unconscious and on a ventilator, they must instruct, do not do an apnea test. No one ever needs an apnea test. The apnea test is done in such a way that it can not help the patient at all. It can only make the patient get worse, and they do that because they want to get their organs. So one of the things that every listener needs to learn is do not do an apnea test. They also have to learn, do not sign up to be an organ donor. And when you're at the License Bureau and they ask you, do you wish to be an organ donor? When you say yes, that gets recorded. But if you say no, that's not recorded. It's not recorded any place. The no just goes off in the space someplace. There's no recording of the no's. We at Life Guardian Foundation do give out medical cards, and we do give out instructions. People need to discuss with their relatives and let their relatives know that they do not want to be dissected alive to get their organs. And incidentally, they're all dissected alive. They're not dead. They're dissected alive. And when they dissect them, that the common practice is not to give them any anesthetic, but they paralyze them so there is no movement when they're cutting the organs, and it's very difficult for the relatives to find out later that their son or their daughter was dissected alive, and their organs were cut out. The kidneys, the liver, the intestines, the pancreas, and oftentimes the last organ to come out is the heart, and they're distributed to multiple recipients, and then the relatives find out that their son or their daughter was not even given an anesthetic when they took the organs, but they were paralyzed so that they didn't move and cause any discomfort to the people in the operating room who might see them, as one transplant surgeon said, as I made the incision down the middle of the chest to take the organs, the man threw both arms up. And of course, that was several years ago, and it doesn't happen anymore because the paralyzing agent does not allow that to happen. So these things are all important from my own vantage point. I would say it's very clear that brain death is not true death. It's not based on any kind of sound philosophy. It's not based on sound theology. Theology has to do with God and the relationship between God and us. God loves us, and God loves us through our entire life, and God does not want us to kill ourselves or to kill other persons. And so, in brain death, if you wait until in organ transplantation, if you wait until true death, there are essentially no organs that you can transplant. So these things are going on, and yes, your listeners need to learn this. So does everybody need to learn it, and they maybe the first thing to do is just think about it and say, well, Donegan, are you a living person? Of course you are. So am I. And yes, we're persons, and we can talk and we can hear and that kind of thing. But the only reason we can talk and hear is because our heart is beating and there's circulation, there's respiration, our livers are working, our kidneys are working, and all of that is going on. And while we pay attention to things like the heartbeat and the heart rate and other things that we pay attention to, in the case of brain death, that is considered to be peripheral to the situation. It doesn't really count. In brain death, they're unconscious and on a ventilator, and the fact that their heart's beating and they have circulation, they have respiration, they just make it that doesn't count. And when they use in the laws, they use words like irreversible cessation of all functions of the entire brain, and including the brainstem. And those words sound strong, but then the determination is made in accord with accepted medical standards, and the accepted medical standards are all set up to get your organs. The law that I just talked about is called the Uniform Determination of Death Act. There's another law called the Uniform Anatomical Gift Act, and that's already been passed in 47 states, and it presumes that everyone intends to be an organ donor. It's presumed that everyone has consented to everything to be done to them to determine if their organs are good for someone else and to keep the organs in good shape till they can find someone to give them to. And that's already the law in 47 states. And then there's another law that's called the HIPPA law, and most everybody's heard about that because anytime they don't want you to get some information, they refer to the HIPPA law. Anytime you go to the doctor or the pharmacy or your insurance agent or wherever you go, you sign a piece of paper. You don't know what's on it, but it has to do with the HIPAA law. And the HIPAA law has a list of 14 ways that the government can get your information without your permission and use it without your permission. And one of the things that's listed in the 14 ways is to get your organs. So you see, it's set up legally so that your organs belong to the government. You think they belong to you, but the government just has to find a way to get permission from you. And if you say yes to the organ donor situation at the License Bureau, they will have that. If you don't say yes, they will still really campaign to get your organs, especially if you're between the ages of about 14 and 40. Not too long ago, just north of here in Michigan, there was a 14-year-old girl who was declared brain dead quickly, and I say quickly just to put that in there, but they left her mother stay by her bedside, and as they continued to prepare her to be an organ donor, she squeezed her mother's hand. Well, that essentially saved her life. And of course, if the person is who's unconscious and on a ventilator can in some way do something to demonstrate they are still alive, then they get a chance. Zach Dunlap, a few years ago, a 20-year-old young man, and who they even published his death certificate, and because he had a relative who worked in the intensive care unit, as the helicopter was landing to take his organs, the relative got a response and stopped that. And in the interviews on the TV, he described how he could hear them saying that he was brain dead, and they asked him, "What did you want to do?" He said, "I want to get up and do something, let them know that I was alive." And you see that little thing that I told you about unconscious and showing that you're conscious. They're different things, because there are many stories of people who are unconscious, how they can hear much longer and that kind of thing, and can hear things after they come out of their coma, that kind of thing. And so brain death is unconscious and on a ventilator and can't take a breath, and that becomes the signal to do something else to get your organs cut out.
Right, and on our channel, our byline here is helping you to be aware and prepared. And my eyes were really opened with awareness from hearing your talk when you mentioned the paralytic drug that has to be given to donors who are alive before their organs are cut out of them while they're alive, so that they won't thrash around. I had never heard of such a thing, but our granddaughter recently was in the intensive care unit with a serious pneumonia and had to be given a paralytic drug so that she wouldn't struggle against the intubation, the breathing tube that she had down her throat. So there it was used to help her get through a therapy that she needed to get well again. So I'm well aware that it is used in hospital settings when necessary, but I bet that most people have never heard that their loved ones, if they're declared to be fit to be organ donors, will have to be given a paralytic drug before they cut their organs out of them while they're alive. And in that, if people knew that, they would be able to have one more piece of information to make an informed decision. But if you could turn to that topic of informed consent, if it's not the individual, and you mentioned that the law has been changed so that you're automatically opted in without your consent. If you haven't opted out, you're in. And how in the world how is the system set up? What is the process that's used to obtain consent from relatives and loved ones if the individual isn't able to speak for themselves?
Well, first of all, so far as consent is concerned, remember that I told you about that apnea test where they take the ventilator away for 10 minutes. How could anyone give consent to suffocate their spouse or their daughter or their father or their mother? You can't get consent for that, and they don't get consent for that. And not only that, But when I've been on the phone with doctors who want to do it, and they say, well, they have to do it. Well, why? Because it's the law. They say, well, and I explain to them there is no law, and yet they go ahead and do it anyway, and overriding what the relatives say, what I say in those few cases where I've had direct contact with the doctors. So far as informed consent, that's a legal term that's out there, and theoretically, if you just take a simple operation like appendectomy to get informed consent, you would have to be informed that you would get an anesthetic. Theoretically, you might not wake up, and you would have to be informed because they make an incision in your abdomen. But they get consent, and you say yes to that, even though it has some risk to it. And you do it because you have a diseased appendix, and the appendix is being taken out. Well, there are multiple doctors in the world now that are admitting that brain death is not true death. But what they're saying is, so what? We want to get their organs anyway, and you just have to get consent. Consent from, obviously you can't get consent from the unconscious person, and get consent from a relative, and they do this in such a way as that they probably aren't going to get better, and even if they do get better, they'll spend the rest of their life in bed or on a ventilator or something even worse than that, and that kind of thing. And so the whatever kind of consent that's obtained, it's a kind of consent that really doesn't spell out how awful the apnea test is, and spell out how there is no way that you can get the organs for transplantation unless the donor's alive. And so if you spell these things out, there isn't anybody that could give permission to have their heart cut out, because that would be suicide, and no one could agree to that, and no one could agree to cut the beating heart out of someone that they love. That would be killing them. And so, yes, they're doing these things without consent, without informed consent. But can you really get informed consent to kill someone who you love? Now, I am aware of the fact that so-called physician-assisted suicide is already legal in Oregon and Washington and Vermont, and maybe another state by now. But while it's legal, is it moral? Is it right to kill yourself? Is it right to kill someone that you love? And the answer is no. And of course, I see what's going on with serious illness, and yes, I am a physician, and there are many good things that go on with doctors and hospitals and the like. But what is going on now is that if somebody gets to a certain age, whatever that is, or if they get a certain illness, whatever that is, then they get sent off to hospice or palliative care. And of course, when I started to do neonatology, every baby less than 3 pounds and 4 ounces that had trouble with breathing died. There was 100% mortality. And other doctors and myself said, let's try. And we did try, and all kinds of things have come out of that, including ventilators that had to be invented for babies, but they had to be very sensitive and very gentle. Well, those sensitive, gentle ventilators are the same ones that are used for adults. Incidentally, a lot of people, you'll hear somebody say, I never want to be put on a machine. I never want a ventilator. Well, ventilators are so different now than they were 40 years ago. 40 years ago, they were not sensitive. They were not easy to use. now they're very sensitive, and they had to be sensitive for the little baby because the little baby can only take in a little bit of a breath. And of course, if you make the machine sensitive for a little baby, sensitive enough for a little baby, it's very sensitive for us big adults, that kind of thing. And things like for little babies, they don't have much blood, so we had to invent micro technique for blood testing. Well, that micro technique is used on all of us now, and all of that came about because we didn't give up on the little babies. From my vantage point, so far as medicine is concerned, I think we give up far too quickly. And if we take those that get sent off to hospice or get to palliative care, it would seem to me that if we tried just a little bit harder, we would invent better ways to help them, and that ultimately helps lots of other people. So I think yes, no one should be an organ donor. No one should get an apnea test, and I think that what we should be doing is protect and preserve life from conception until true death, and that's what Life Guardian Foundation is all about. You can look at our website, lifeguardianfoundation.org, all three words together, lifeguardianfoundation.org, and you can see and review presentations that I've given at other places, and also you can find a way to get the cards that we send to you, the medical cards that you should carry with you, and we also have booklets that we send out that has instructions about how to set up power of attorney. And the power of attorney that you would set up with your spouse is to protect and preserve your life. And then the other thing that is so important is that when children become 18, they reach the age of majority. And then the law is that there is no one that speaks for them. No longer can their parents speak for them. So those young people who are becoming 18 and going off to college need to designate in an official way that their mother and their father are the ones that have power of attorney for their health care, so that their mother and father can speak for them. Because at least in some states, if someone is not designated, then it automatically goes to court, and then the court can appoint whomever the court decides. And there's every indication that it might not be a relative that would be the one appointed to make decisions for your child who has recently reached the age of majority. So www.lifeguardianfoundation.org, and you can get more information. We will send things out if you request them, and go to our website and learn more about the things that we're talking about.
Now, if I could circle back one more time to that topic, we're talking about educating yourself as if your loved ones might get into a situation, heaven forbid, where you would be approached and asked to give consent for them to have organs harvested from them. If you talked in your lecture that I attended about the process that is often used to sort of coerce or direct the course of that obtaining of that consent from loved ones who are in a very stressful time and who might not have this information that you're giving us. What is that process, and how is it used to basically stack the deck in favor of people agreeing to organ donation for their loved one?
Well, what happens in the hospital is that it's set up so that as soon as somebody is unconscious and on a ventilator, especially if they're under 40 years of age, the organ transplant people are contacted immediately. Furthermore, your doctor or the doctors and nurses at that hospital are not allowed to request permission to get your organs. The organ transplant people employ designated requesters, is what they're called, and they know how to be nice to you. We've watched them work. They will bring you a cup of coffee. They will be very kind, and then they find out if there's a mother or a father who might be more likely to give in. And then they separate them, and then they get the weaker one to say yes, and then their job is to get the others to say yes to get the organs. But all of this is set up to get your organs. You have to understand that the organ transplant industry, and that's what it is. It's an industry. It's a multi-billion-dollar industry. It's completely dependent on getting healthy organs from living persons. They can't get organs from a cadaver. And furthermore, it's set up by the federal government. The federal government is the one that supplies much of the money for organ transplantation. You know that Medicare was started out to provide health care for persons who are 65 and older. Yet Medicare participates in paying for almost all organ transplantation procedures, and it cost, a body is worth probably at least $5 million for their organs for the organ transplant industry, and so it isn't that I'm opposed to people living longer. Of course, I want them to live longer, but in the case of heart transplantation, they really don't do as many as they formerly did, because they realized that if you just gave better treatment to the heart that's there, they do better than if they get a transplant. So they don't do so many heart transplants anymore. They used to do more partial liver transplants, but then a brother in Colorado gave part of his liver to his brother, and in about 5 or 6 days, the donor was dead, and in about 6 months, the recipient was dead. And then they looked around and they found 5 other cases like that where partial liver transplant resulted in the death of the participants. So they don't do as many as they formerly did. And of course, you can't do a whole liver transplant unless you kill the donor. And then there are things that we find out that with better nutrition and vitamins, that livers that weren't able to heal are now able to heal. And of course, kidney disease, dialysis, people can live a long time on dialysis. And of course, it's not as convenient as the kidneys that we were born with and don't have to use dialysis. But on the other hand, to get a kidney for transplant, the donor either becomes dead in the process or becomes weaker. And so these things about the ones that they take the organs from, those are generally not, information about that is generally not well publicized. But it's important that that all of us learn about these things, learn that brain death is not true death, learn that you cannot get any organs for transplantation from a cadaver, learn that you have to have power of attorney once you reach the age of majority, learn do not do an apnea test, and these are the kind of things that all of us need to learn, and we need to discuss them with our relatives and become versed in the subject so that we can do things to protect and preserve our life. And in medicine, if we do things to help the ones that are the sickest, then ultimately many other people get benefit from those things that are done.
Now, you also looked at the civic and civil and moral aspects of this. You said that in your talk that in our very founding documents of our country, we are declared every person to have the unalienable rights to life, liberty, and the pursuit of happiness. And you also talked about the 13th Amendment against involuntary servitude. But here you've said that despite these assurances of our Constitution, our life is not going to be protected by the government, just the opposite. And in fact, we are, unless we educate ourselves and opt out of the system, we are opted in to become basically ripe for the harvest of our organs while we are alive, which certainly qualifies as involuntary servitude. Can you expand on any of those topics regarding to our civic rights and moral rights about this?
Yes. Well, so far as our life is concerned, the Declaration of Independence pointed out that there were inalienable rights, inalienable gifts. They come with our life, liberty, and the pursuit of happiness. And liberty, by the way, is a word that's different from freedom. Liberty is rooted in the word liber, and the second part of it is arbitrium, which is mastery. So in Latin, the words are reversed, liber and arbitrium, and you reverse them. It's mastery over desires. And mastery over desires is to do good and avoid evil. And that's the gift that we get from God, which is different from freedom. Freedom comes from man. When you rent an apartment, you have the freedom to live there and have your friends visit, but you can't raise chickens. Could the landlord give you permission to raise chickens? Yes, because it has to do with man. Freedom comes from man. Liberty comes from God. Now, so far as the 13th Amendment of the Constitution, which is against slavery and involuntary servitude, the Uniform Anatomical Gift Act, which has already been passed in 47 states, makes it so that it presumes that everyone intends to be an organ donor. Everyone has consented to everything to test you and to get you ready to be an organ donor. I would really question if this is not against the 13th Amendment of the Constitution, which in the state of Ohio, where I live, is Article 8 of the Constitution of Ohio. And I think that it's involuntary servitude to set you up to be an organ donor. Whatever there is, certainly people need to be informed and to get permission. But there's essentially no information that's given and no permission that's obtained when they draw the blood studies to find out if your organs are good for someone else. And once they find somebody, then to keep them in good shape until they can find someone. I think that those things are against involuntary servitude, and essentially, haven't they made slaves of us because they do not inform us of that? These things are going on, yes, at the federal government level, but it's going on in every state government level, and we're not informed. And if we're not informed, then essentially the government is keeping us from being informed. And so I would really bring up the question, is it not a form of involuntary servitude to be doing this with the Uniform Anatomical Gift Act? In some ways, the HIPPA law is similar also. We're not informed that in of the 14 ways that the government can get our information without our permission. We think that the HIPAA law is there to protect our records, to keep them private and that kind of thing. But let me tell you, every doctor that ever went to medical school got it drilled into his head the first day of medical school that you don't talk about the patient in the elevator or in the cafeteria in the same way for nurses. So doctors and nurses never had to have any special law to keep this information private because we always did. So why did you have to have the HIPAA law? It's for the 14 ways that the government can get your information without your permission, and one of them is to get your organs. And these kind of things are there. How do I find them out? I go read them. You can read them. Anybody can read them, and that kind of thing. And while you're reading, I encourage you to go www.lifeguardianfoundation.org, and you can learn more about all of these things that Dunnigan, you and I are discussing in these few minutes.
One last topic before we let you go, and that's on the psychological aspect of euphemism and the creative or coercive, manipulative use of language to move people to do what you want them to do. The fact that all the posters for this are in the lovely pastel greens and blues that are used for environmental subjects, that we see smiling recipients on them, and the phrases are always around donate life, share life, give life, is in stark contrast to the grisly and horrific reality that you've described for us. The only thing that comes to mind when you talk about an extended surgery, I know in your talk you spoke about how it can take 3 hours to remove a liver and an hour to remove a heart. To think about a person being paralyzed and yet not anesthetized as they're cut open and their organs are excruciatingly harvested alive from them, the only thing that comes to mind like that is what we've been taught to be horrified about the Mayan and Aztec cultures, where they did human sacrifice to appease the rain gods and that sort of thing. And yet to think that sort of horror is going on in our culture today, in our modern, supposedly scientific, supposedly informed culture, and yet all we can talk about is share life and give life. It seems to me that when you need to fall back on not calling things what they are and making up terms to disguise what's going on is a sure tip-off that you're trying to conceal and you're trying to make something what it's not. And I really appreciate you coming here and so drawing back the curtain and really helping our viewers to be aware and prepared. A lot of the topic of prepping or preparedness, people think about potential breakdown or collapse of either financial or infrastructure of society, that sort of thing. But this kind of preparedness is for something that is almost a certitude. Certainly we will all die, and if we become unconscious at an early age, and we may very well have ourselves or a loved one in the situation where we better be aware so that we can be prepared for that. And just thank you for being here to share that information with our audience. And again, they can go to www.lifeguardianfoundation.org to get those resource cards that allow them to express that they want to be do not hasten death, protect and preserve my life, do not do an apnea test, and give durable power of attorney to those who can speak on their behalf. So thank you. Any final thoughts from you, Dr. Byrne, before we end this?
First of all, to say thank you, and I'm grateful for the opportunity to do this. And yes, what you described in the last few words there, it's brainwashing is what it is. Brain death is not true death. It's brainwashing. It's fake death. All people that are called brain dead are living. None of them are truly dead.
Thank you, Dr. Paul Byrne, founder of Life Guardian Foundation, for joining us here on Reluctant Preppers.
Thank you very much.